Good afternoon, everybody. Welcome to Facebook Live. I'm Justin Westmiller, the Director for Homeland Security and Emergency Management. And we have a special guest today, Dr. Reddy, the Chief Medical Officer from Lake Huron Medical Center.
Good afternoon, everybody.
Welcome.
Thank you.
So right off the bat, we'll do what we normally do, and we'll jump right into the status report. Obviously, we have some increased numbers this week. We have 239 cases with 498 active cases for a total of 1,647 cases to date. We have 14 hospitalizations this week with 198 total hospitalizations. Currently, we have 34.1 average cases, or average new cases per day, and we're testing around 550 per day. And our percent positivity of 5.2%, it is going up. Obviously, we've seen a slight increase since about the first or second week of September. We have unfortunately had one death this week, and so that's that for our current numbers. On the next page, you can see that our graph has really spiked upwards, and we don't see any sort of downward flip on that yet. We are looking for that anytime, but we're not quite sure when that might be, just because of the number of new cases that are coming in daily. The next slide shows our percent positivity for testing has increased to 5%. We're right on the line at 5%. We're really at 5.2, but so that tells us, Doctor, that we are seeing some increasing numbers and some issues.
So when you look essentially at hospitalizations and the percent positive rate, you can get a feel for which way things are going. And there's a slight uptick in the state for hospitalizations and in our county for the positivity rate. What I think we need to be focusing on is, again, trying to bend this curve, if you will. So let's assume that there are 10 people who are positive for the coronavirus. We want to make sure that they're not infecting 20 other people. We want to cut it, face mask, socially distance, self-isolate when we're waiting for a test, to try to see if those 10 people can infect less people, so maybe 5 people. And then those 5 people who get infected might infect 2 more people, and then it kind of peters off. We don't want it to where the 10 people infect 20 people, those 20 people infect 40 people, and then we get essentially to where we've lost control of the virus. Looking at the graph, that the last one you saw, which is the percent positivity, we're still in pretty decent shape, even though the trend is going the wrong way. So hopefully we can bend that curve the other way. We still have time, and we need obviously everyone's help in socially distancing, isolating, and wearing something as simple as a face covering.
Thanks, Doctor. So just today, probably 45 minutes to an hour ago, the health department released to the public what's called a public health advisory, and it talks about how cases have increased significantly over the last 2+ weeks, and the health department has reached capacity when it comes to timely contact tracing and disease investigation. So they have, the health department has put out a reprioritization strategy effective immediately, and we're going to focus our main efforts on probable and confirmed case workup in people years 18 and under. We're going to focus on contact tracing in the long-term care facilities, hospitals, and schools, as well as any other clusters, large clusters that show up as prioritized by the health department administration. And thirdly, we're going to assist with businesses with COVID-related issues. So for businesses or schools or anybody else listening, please know that at any time you can call into the health department and they will provide you information and let you know where the situation is at, or let you know that they haven't heard of it yet and start asking you more questions. So the second part of it is, this is the most important part. For those singular cases out there, if you are told that you are positive by a qualified medical personnel, such as a doctor or a physician's assistant, be proactive, please. We need your help with that. You may not get a call at all from the health department at this point. So what's important is anytime you find out that you're positive, you need to isolate for 10 days. If symptoms improve, you may, and you are fever-free without the use of medications, it may be okay to return to activities. Notify all of your close contacts. So what we're doing for those singular cases is we're asking for help from the public to help do a little bit of that case investigation for yourselves. And sometimes that's more comfortable, right? Because you feel like you're telling a government entity, hey, this is my life for the last 2 weeks. Take it upon yourselves at this point to let your friends and family know if you were in contact with them and that they need to self-quarantine for 14 days from the last contact they had with you. And obviously, for any of your close contacts, if any symptoms arise, they need to get tested as soon as possible so that we can continue to understand where things lie. We are not abandoning efforts by any means. We just have to, because of manpower availability and the number of cases increasing per day, we are just creating a strategy that helps us maximize our efforts. The health department and the EOC, we continue to work extremely well together, and my staff and I are providing resources while the health department does their job with coronavirus. So the three strategies that every person listening and every person in the county can do is masking, social distancing, and proper hand washing. And remember, at all times, distance is always your best friend. Doc, do you have anything?
So essentially, what I gather is that we have to help each other take care of each other. And, for example, if someone is under investigation for coronavirus, they have the signs and symptoms, whether you do or don't have a test, just do the common sense thing to protect your friends, family, and all of us at large. The way we can get together and come together as a society to help each other is by staying apart. That doesn't mean that we forget the people who are under investigation. We want to maybe set up a schedule, call them every 12 hours, see how they're doing, see if they need to be in a hospital, see if the best thing is they might need to stay at home, but not again give up on anybody that you know. So I think as a society, if we set up strategy amongst ourselves on taking care of each other, again, we can come together by staying apart, but keeping in touch so that no one falls through the cracks.
All right, Jen.
Okay, you ready for questions?
I am.
Okay. Dr. Reddy, we'll start with you.
Sure.
Could you repeat the question too in case people can't
Yes.
hear me? What are your thoughts on reaching herd immunity through infection and abandoning efforts to contain the spread?
So the question is, what are my thoughts on reaching herd immunity through infection and abandoning efforts to contain the spread? I think it's very important to reach herd immunity, but I think it's important to achieve herd immunity safely, and the safe way would be through vaccination. So I believe that trying to achieve herd immunity through infection is a strategy that's dangerous and actually can cause a lot of people to actually die, to be quite honest with you. So I think what we need to do as a society is to rely on the medical profession, on the FDA, on the scientists to come up with a safe strategy to create herd immunity through vaccination.
Okay, Justin, question. What about the schools?
So schools obviously are in that priority area where the health department is going to continue to work with them. We don't have really a major uptick in cases in schools. We have no transmission between two students or staff and students. We have no EpiLink transmission cases in schools, with the exception of one. So I guess I shouldn't say we don't have any. We have one, but it was very, very minimal, very easy to control and get our arms around. And that school district has done everything they need to do to maintain the students in the classroom. if I may too, I know there's a couple comments on there about why don't I have my mask on and the doctor does. So I just want to talk about a couple things. One, obviously we moved our Facebook Live to the EOC. We are in a very, very large room, and there's at least 7 feet between Dr. Reddy and I. And while I'm doing this conversation, there are many people at home that have hearing issues, and they read lips and other social cues to understand what people are saying. So that's why I don't have my mask on. Rest assured, it's right here. As soon as we're done talking, it goes right back on. We sat here for 30 minutes or so talking, and our masks were on the entire time. So I just want to clear that up.
Okay. A couple questions about the schools.
Okay.
Why are they still open? If you could elaborate, maybe explain why, when they would.
Sure. So why are schools still open when our case rate is obviously growing at a high level? That's a not so easy question to answer, but I do have the answer for you. So, number one, like I just said, we do not have any student to student or student to faculty transmission ongoing in any of our school districts, which is probably the top requirement that our superintendents of all of our school districts would need to look at to make that closure decision. All of our school districts in the county do have plans to make that happen at the appropriate time, but this is not yet the appropriate time. And remember, schools are much more, they're much more taken care of. Their ability to manage what's happening inside of their buildings is far easier than the general public in our county. Doc?
Yeah, I certainly agree with that. I think it's important for kids to learn.
Yes.
And I leave that to the education professional to decide what format that should be. Having said that, you obviously want kids to be safe. And I think the decisions typically would be made metric driven. So driven by data, driven by what happens. And it's nice to know that they actually have a plan in place so that if things were to change, they could make those changes fairly quickly.
Okay, next question. Can you please clarify recovered when you post them?
So when we post recovered, all that means is that the cases that we have cleared the state MDHHS requirements. You can tell me if I'm wrong, but I'm getting the nod yes. Mm-hmm. They've cleared the state MDHHS requirements for having gone through enough period of time to be considered recovered.
So if I may just comment on that. So
Sure.
Recovery is a statistical definition or a case definition that's set up by a bunch of people who got together to came up with a certain time frame. So there's nothing pristine about 30 days. If you actually look at the science, it could be 26.7 days or 80 days or whatever it is. In general, when someone has a bone broken, it might take about 6 weeks to heal. If someone gets cut, it might take 6 weeks to where when you put your hand in hot water, it isn't burning as much as the other side. So assuming that you get beat up by a virus inside, it might take you up to 6 weeks to kind of get to some sense of norm from a general medical inflammatory inflammation cascade kind of definition. There are obviously some patients who medically recover much quicker than 30 days, some take longer than 30 days. And from a medical perspective and personally, just leave it up to your healthcare professional to help advise you and guide you through when you think you have or have not recovered. Because there are some patients who have symptoms that are long-term, but the virus itself in those patients may actually be dead.
Okay. A lot of chatter on here about people seeing that there are people not following the Michigan mandate. So could you please talk about, are businesses still required to enforce masking and social distancing?
So the question is, are businesses still required to follow a mask mandate? And in the state of Michigan, yes. Under Director Gordon's proclamation through MDHHS, you are required in any public place to wear your mask. That means go into the store. That means going inside of a gas station. Anything that's a public area or you're with non-familiar units, you must wear your mask if you can't stay outside of 6 feet with them, and any times indoors. Doc?
So there's nothing pristine about 6 feet. There's nothing pristine about a mask. A mask prevents spread of the coronavirus, but it's not absolute. And there's nothing absolute about 6 feet either. So the least amount of time you can spend in a situation where you can maintain a distance and wear a mask is the way to do it. So when we see patients, for example, in our office, we see them quickly, we get to the point. Unfortunately, I'm not able to spend that social time that I used to in the past because I care for them, to not be exposed to anybody, because there are people who are asymptomatic as well.
Okay. Will the county be a part of the new state health mandate requiring restaurants and bars to collect phone numbers for contact tracing?
So that's a very good question, and I may defer that question until we can gather more information, and we'll get back to you on on your Facebook post on that one.
Good. Next question, who is enforcing the mask mandate?
So enforcement, right now, the health department is authorized to enforce it. Local law enforcement is authorized to enforce it. Should it become a public issue, a public endangerment issue, that's how we're managing it here in St. Clair County, and we've done very well with that so far as on an enforcement leg. The key to enforcement in something like this is more education than everybody running around with handcuffs or ticket books or anything like that. You will be asked many, many times and given a lot of information should you have any sort of interface with the health department or law enforcement.
So, when it comes to things like face masks and mandates, it's really not what's asked of us by a government. It's what we're asking ourselves to do for each other, honestly. And that's where the education comes into play, where as a society, we have access to scientific material, not so scientific material. But the way to get out of a pandemic is to educate ourselves out of it and use our resources carefully.
And key to that too is, remember, politics aside, we know that masks, like Dr. Reddy said, may not contain everything, but it will surely cut down on what's being expelled and potentially what's being brought in depending on what kind of mask you're wearing.
Dr. Reddy, this question was for you. What are you seeing for recovery times in your practice, and how are asthmatics doing with COVID?
So actually, in our practice, asthmatics are doing fairly well compared to other years. And I think it's because they're actually socially distancing. And I'm not sure why. They've not been afflicted by the coronavirus as much, but in specific cases when they do get affected, they do have a longer recovery time from an asthmatic exacerbation. What I'm seeing is the patients who actually have diabetes, I think, are having worse outcomes and longer recovery times. Recovery time for them to get back to their baseline has been a little frustrating. Instead of days when it usually used to be, it's more like weeks. So I toy around with this number of about 4 to 6 weeks, but I think that's kind of extending out into maybe 8 weeks or so. And there's an occasional patient who seems to have a worse time than previous years, even a month or two after their initial infection.
Can you explain what events have occurred to have 212 cases since Monday?
So, no, I can't explain individually why we have, 212 cases. What I'll tell you is it's clear through the percent positivity and our continuing rate upward that it's not beyond the realm of the possible that we're going to continue to see more and more cases at that kind of alarming number. Doc, do you have any thoughts on that?
So I'm happy that we're able to capture more cases by doing more testing. But even accounting for that, when you look at the percent positive, there is a trend upwards. So I think I look at all the data, that's the percent positive rates, but also hospitalizations, as well as the fact that there are more number of absolute cases. Some of the increase in absolute cases is just reporting because we've tested a lot more. And I think that's a really, really good thing that we're testing a lot more and giving information to these individuals so that they can proactively self-isolate themselves, call their family and friends, whoever they have potentially exposed, to again do the same thing.
Okay, this person asked, so can I keep my kids home and not get into trouble because they missed so many days since the numbers are going up?
I believe every school district this year has modified their absence policy due to the pandemic. So I can't answer for your individual school, but I would recommend that you contact the building principal for your school, and they will have the most up-to-date information on that. But in my opinion, they have modified those rules for this year.
Okay, next question. So you are no longer going to report businesses anymore of probable cases within?
No, that's not what we're saying at all. That's a requirement to report that. And so that reporting will continue. And businesses are part of our strategy to continue case investigation. So you should expect that we will continue to do that. What you may see is there will be potentially a slowdown of the time it takes from the positive case received to the time the health department can get to the case investigation. And that's just due to sheer numbers.
This person asked, is a general public notice, like a press release, a local media advisory, still required if the establishment takes names and numbers and turns that over to the health department for direct contact tracing?
So normally when we do press releases to the public for businesses, it's because we don't have a good understanding of who may be impacted. And so we're trying to put a broad warning out to everybody just to pay attention to themselves, pay attention to symptoms. The best answer for this question is potentially it could be a case-by-case basis, but I don't see much changing in the way we deal with businesses right now, especially since it's a priority.
All right, doctor, this would be for you. Can you explain how when someone tests positive and then they get tested again, they only count as one positive? Many people are confused and feel they're being counted every time as a new case.
So essentially, if you have a test and it's positive and you get retested many weeks later, you could still be positive depending on what test is done. It doesn't mean that you got reinfected. It could mean that your test is positive, and that's all it means. So I'll give you an example. Someone has the coronavirus today. They get a test for the virus PCR. So these are fragments of the virus, and they turn out positive after it was amplified once or twice in the test. So it was like a high positive. And then about 6 weeks later, they test positive again, but it took 30 times for the test to amplify itself to become positive, and that would be a low positive. Because all these tests have emergency use applications, we don't really have a way to quantitatively look at that, but that's the logic. So what this would mean is that in the first test, the virus was alive, the person was symptomatic. In the second test, 6 weeks later, they didn't have any symptoms, and they most likely picked up a virus particle that was dead or left behind, which takes several weeks to clear out of the body. So let's say you have 10 viral particles. In 1 week, you might have 5 viral particles. The week after that, you might have 2.5 viral particles. The week after that, you might have 1.25 particles. And for a long time, you might have very, very small amounts of particles, even though the virus is dead, that you can pick up on a test, because the tests are very good at picking up stuff once it's in the material.
Okay. Next question. So cases drop off of the case count at a set period of time, and are considered recovered regardless of their actual health? Question mark.
So from a statistical perspective, the understanding is that the way public health data is collected, the patients who live beyond the 30-day mark are considered recovered. And that's just a way to, I think, help figure out how much resources we need, who's active, what personnel do we need during the time when they are considered not recovered. This does not in any way mean that after 30 days they don't continue to have symptoms. They might have symptoms, and in fact there are some patients who actually have an outcome where they actually pass away after 30 days, and that would actually not be considered recovered. In any event, there are some patients who require many days in a hospital. There are patients who have walked out of the hospital after 45, 50, 60 days. They were statistically considered recovered in a database at 30 days, but they obviously had not recovered completely by then.
Okay. Yeah, the same thing. A lot of questions about recovery.
Yes.
Definition, because someone's also asking, do you have to have a negative test to be considered recovered?
So you do not have to have a negative test to be considered recovered, and the reason is because the test can remain positive for several weeks. For that reason, good old-fashioned medicine, where you have a positive test initially that helps with the diagnosis, you look at your symptomatology, which is again fever, chills, cough, sputum production, and the definition for someone actually being able to return to work, to get back in the swing of things, is again symptoms that are that drive that timeline, and that's, for example, 10 to 14 days after your last symptom is where you're considered non-infectious.
Someone wants to know if we can change our county map by taking the old cases off and just putting the new cases on so we see the hot spots.
And no, and here's why. That map is to show cumulative numbers in each municipality or each zip code, I think is how it's broke down, zip code, right? So if we go to a practice where we take all that data off and we just show the weekly new cases, sometimes you could actually, it may be a violation of HIPAA, because you can actually figure out who may be sick and who may be impacted. So that's not a practice we're going to take up at this point.
More chatter on here about businesses who aren't following the order. Who can they report violations to?
So you can report violations to the health department at COVID-19 at stclaircounty.org. That's the email box. That's probably your best way because you can provide the most information. There's also a telephone number, and I'm going to lean on the health department here for a second.
810.
It's 810-966 4163. And that's the COVID hotline where you can also make those complaints.
After someone tests positive, how far back do they go to see who they were in contact with?
Doc, do you want to take that one?
So if someone tests positive, I think the prudent thing would be to go back 2 weeks to see who they were in contact with. And that's just based on the natural history of the disease that we know so far on how a patient can kind of get contracted the virus and then develop symptoms.
Okay. Next question. Are there many flu cases in the county right now? Do you know?
Not that I know of.
Right. Yeah, and that's the same information I have currently. Obviously, we're just in October. We haven't seen any sort of outbreak or any sort of major impact with seasonal flu yet.
And we're going to try to keep it that way.
Yes.
By vaccinations for influenza, as well as social distancing.
Let's talk about Halloween.
Awesome.
Coming up. So somebody asked, are Halloween parties okay to have?
So remember, I'm not up here to tell you yes or no, you may or may not do something. My job is to give you the information on, we know distances are key. We know wearing masks is a way to start winning this battle. We know that proper hygiene practices also help keep viruses at bay, such as hand washing, etc. So MDHHS has rules, indoor gatherings up to 10 people, right? And outdoor gatherings up to 500 people, depending on what the square footage of that facility that you're having it outdoors, or if there's seated capacity, it's 25% of that seated capacity. So again, I'm not going to say yes or no, you should or shouldn't. What I'm saying is we know getting together in non-familiar units right now is one of the most dangerous things you can do with this virus, and you have to make that personal decision to not do those things that could spread the disease and cause harm. Dr. Reddy?
I echo the same comments. I mean, social distancing, but just engineering yourself out of that space or not needing to be there, I think is the better way and the best way to kind of accomplish this. So I would use the common sense metric in addition to the epidemic orders that the state has on essentially trying to be there for each other by staying apart.
And what I'll say too is, if you do decide to have some sort of party, whether it's indoors or outdoors, and some of the things you need to really do, make sure everybody's wearing a mask. That is one of the high keys to at least, if you're going to put yourself in a difficult situation, make sure you're doing everything you can to stop the spread of the disease.
People are asking you to repeat the question, by the way.
I apologize. I'll do that. The question was, is it okay to have Halloween parties? And that's the answer we gave.
Okay. Next question. How many people are symptomatic?
How many people are symptomatic?
So right now, 85% of our active cases.
Okay, so the question is, how many people currently are symptomatic? And roughly 85% of the positive cases in St. Clair County are considered symptomatic at this point.
And then somebody asked asymptomatic.
Well, then it'd be 15%. So asymptomatic is 15%.
Okay. How effective are rapid tests?
Dr. Reddy? The question is, how effective are rapid tests? Apologize.
So the question is, how effective are rapid tests? And this would go for any test, not just rapid tests. It depends on how you do it. So if you're doing a PCR, it really depends on how the specimen was collected. Was it collected in the right area? Was it collected deep enough? And then again, once that is done, I think most tests are actually pretty good once a specimen is collected properly. The only other thing is that you may not be picking up all the subtypes of the virus. And this is, for example, quite a bit of a problem, I think, in the antibody tests. So you do an antibody test, but you didn't pick up the right subtype of coronavirus or the right serotype, and it might be negative. So again, we would use a common sense standard. If you live in an area where there is widespread community transmission, or you've been exposed to somebody, irrespective of whether your test is positive or negative, you still want to basically do the same things that you would do. You would consider yourself positive because you have the symptoms and you're in this area, and socially isolate, call your family and friends and tell them to watch for symptoms as well. Specifically for the rapid test, we think it's not as specific, if you will, as the PCR, which is not as rapid.
We are over our time, but
We
we have
are.
a lot more questions.
Dr. Reddy, it's up to you. I'm good. Yeah,
I'm good.
Let's keep going.
We'll go for a few more. Our doctor's office is required to do COVID screening.
So I don't know what the regulation actually says, and you might be able to help me on that, but we do screen all our patients and our employees. And I believe most doctor offices do that.
Yeah, so MIOSHA requires that it doesn't matter where you are, you are required to do a screening prior to entering or just upon entering. So it doesn't matter if it's a doctor's office, a plant where they manufacture things, the EOC here where we do it. Doctor had to sign in about an hour ago. It doesn't matter where you are. You're required to have a COVID response plan. You're required to have a COVID screening plan, and you're required to make sure that your employees and visitors follow that plan.
So the next question after that was someone who went to a doctor's office, they weren't doing that. How should that be reported?
Same way as
The question is, how should it be reported if you come across a doctor or anybody else that isn't following the requirements, the MIOSHA requirements, to have a plan and to have a screening process? And my best answer to that would be to call the St. Clair County Health Department hotline at 810-966-4163, or get a hold of the group on email at covid19@stclaircounty.org.
All right, question about the state. So the state just reports last 7 days cumulative, correct? No daily count?
the state does.
To the state dashboard. They report those 7 metrics, and I believe they should be reporting it daily.
They do report a daily count.
Yeah.
And it's county, it's
broken down
per
by county
Yep.
and region.
That's right.
Yeah.
It may not be on the map that you see at the state website, but it's in the weeds, if you will.
Yeah. It's in the coronavirus tab on MDHHS's website, and then I think there's a tab for data, and that's where it's at.
Okay, so people want clarification. If you test positive once and you retest, are you only counted once as a positive?
Yes.
Yes.
If you test positive once and you retest a couple more times after and you still come up positive, you are still only counted as one case.
Okay. When should we expect widespread rapid testing in this county, more specifically in Port Huron, where the cases seem to be concentrated?
So, a couple of things on that. We already have, for in-hospitalization patients, we already have a rapid capability to do molecular testing. And we expect very soon, I don't have a date for you, but we expect to have some capability to do rapid antigen tests out of the health department in the coming weeks, we believe. So it's not here today, but it will be here very soon, and it is in the population. I know there's at least one urgent care facility that's doing rapid antigen testing, and on the health department website, there's a listing of many, many more that are just outside the county that will also do rapid antigen testing for you.
Okay. If someone has recovered from COVID and is notified a month or two later if they've come in contact with someone who's positive, do they need to quarantine again for 14 days because there's multiple strains out there, or would the person not have to worry about it because they have antibodies?
So if a patient has had the coronavirus infection, they've recovered, and they get exposed to somebody, and it's a credible exposure, so it's a family member, they've had pretty good contact, then they should do the same precautions that they would have done if they didn't have COVID in the past, because we're not sure if people can or cannot get reinfected, because there are cases where people are reinfected. They need to continue to, for example, wear their masks. They need to continue to do the same things that they did before. And my recommendation would be to self-isolate if they're being worked up or they're being tested as well.
I think I got to the last question.
All right.
So I want to say one more thing.
Okay.
So I just want to say that I've been here twice, and the questions get tougher and tougher each
sure
time.
do.
And there was one question that we didn't get to, and it was, when do you think we will have a vaccine, and will it be safe? And the answer is, we will have a vaccine when it is safe.
Right.
And that's all I have for you on that.
That's a huge statement, right? So understand that, there's 3 or 4 that are moving around in the final stages, and like Dr. Reddy said, we won't get access to one of those vaccines until the FDA has deemed it safe. Mm-hmm. And that's the process, and they never change from that process for vaccines. So
2 more questions and then
Okay.
closing thoughts.
last 2 questions.
what seems to be the main reason for our increase in COVID cases besides obviously more testing? Anything else?
So I can answer that one, and then I'll let Dr. Reddy jump in. So basically, we are seeing a lot more interaction from non-family members in every parts of our community. And that's not abnormal, right? Because it's getting colder out. People want to still be social. People want to be human. And I totally understand that. Right now, we just need you to fight back a little bit on our normal practices and practice these protections that we know work for coronavirus. Dr. Reddy?
Think about like a liquid, let's say clear water, and then there's some red dye in one part of the pot and some in blue dye in the other part of the pot and green in the other part of the pot. The pot basically is like mixing a little bit more than it used to, and that's how the virus, I think, is rearing its ugly head again, just from a little extra mixing, which is kind of the same thing what he was saying.
That's a great analogy, though. I think I'm going to steal it. Hope
You
you're all
should.
right with
I
that.
like that too. Okay, last one on our live feed so
Okay.
far. Is there a map on our Facebook page with only the active cases per city and township?
And no, and I answered, is there a map with just active cases by city or township? And I answered that a few minutes ago, but I'll do it again. Here's why we can't do that, because when we remove all the other cases and we just show the new cases by week, you could potentially, depending on the area, single out who is sick and who isn't, and that would be a violation of HIPAA or privacy laws.
Closing remarks, Dr. Reddy.
I just have the thing that I said before, I think, which is that there are new acronyms, new ways of greeting people, new ways of saying goodbye. So all I'm going to say is be safe.
And I'll follow that. Listen, obviously we've changed our messaging, we've changed our tone a little bit. Things are getting more serious, okay? So in turn, we need you to just be a little more vigilant and a little more serious about what's going on. I understand, we all understand the political divisiveness and all that stuff, but I will reinforce that this virus doesn't care, and we're just requesting emphatically that everybody do their part to help get through this. And that's all I have. Thank you so much.
Thank you.
Have
Thank you for having me.
Have a great weekend, and we'll see you next week.